Athens, Georgia, the Affordable Care Act. The Affordable Care Act was signed into law by President Barack Obama on March 23, 2010. Open enrollment for the health insurance provided by the Affordable Care Act began October 1, 2013, and the health care reforms are set to begin January 1, 2014. The Affordable Care Act is the most extensive overhaul of the United States healthcare system since President Johnson passed Medicare and Medicaid in 1965. The passage and the rollout of the Affordable Care Act has met harsh criticism and obstinance in Washington, D.C., including a Supreme Court case that challenged the legitimacy of the law, the government shutdown that delayed the Affordable Care Act's budget, and 20 states refusing to expand Medicaid coverage. But let's ignore the controversy in Washington, D.C., and instead focus on how the Affordable Care Act will affect our hometown, Athens, Georgia. When we think of Athens, Georgia, we think of the University of Georgia Bulldogs. Drinks and live music in one of the many venues in downtown Athens, and the academic and research opportunities at the University of Georgia. But what do you know about healthcare in Athens, Georgia? Those who have health insurance and those who don't. Those who could receive healthcare for the first time under the Affordable Care Act, and those who would still be unable to afford it. Based on data retrieved from 2011 Census Bureau data, 16.8% of the Athens area population does not have health insurance, totaling 26,319 persons. The biggest question for the uninsured population is if they qualify for the Affordable Care Act, according to Dr. Geraldine Clark, Director of Resident Support for the Athens Housing Authority.
Well, people just want to know what's available to them. More so than accessing it, they want to understand how it's going to benefit them, how it's going to help them. It's an unknown. And so anytime that, you're dealing with an unknown, there is a level of anxiety. And that's why we're providing information for folks so, they will know what it is that they need to do.
The variables that do determine the eligibility for premium tax reductions on healthcare include age, family size, whether you smoke or not, and income. Wherever the household income falls on the federal poverty level spectrum determines the tax credits. This distinction, albeit confusing in a maze of numbers, is important when shopping for healthcare, according to Jennifer Richardson, the health educator at the Athens Neighborhood Health Center.
For that,
people are middle class people who are for household income, total income 95,000, 94,000.
Okay.
They anywhere from there, as long as they're within the 138% to 400% of the federal poverty guideline, they qualify.
Jennifer Richardson and Geraldine Clark urge those with unanswered questions to visit the two Athens Neighborhood Health Center locations. How would the Athens community be affected by wider access to health care?